Yeah, beat your addiction, live free. Ralf Friedrichs is who you see. Listen in when you're feeling low. Take back your life, today's show. Beat your addiction, live free. Ralf Friedrichs is who you see. Listen in when you're feeling low. Take back your life, today's show. Stay positive, hope, and keep faith. Stand strong against any odds that you face. Put away the alcohol and the drugs. Fill your time with the things you love. Addiction is tough, but it's worth the work. Treat your body what it's worth. Spread positivity, inspire all. If we stand together, we will never fall. I help others see the other sides of life. A sober life, letting go of the strife. So give me a call, I can help. 1-844-4405-HELP. Homeless shelters, hospitals, jails, wherever you are. I am Ralf Friedrichs and I am here for you. 1-844-405-HELP.
Good morning. My name is Ralf Friedrichs. I'm an author, addiction recovery coach, and the host of this show, the Take Your Life Back radio show. Today, I'd like to talk about some parents introduce kids to drugs. And I know they maybe purposely don't do this, but for whatever reason, because of maybe how they act in their own home, the kids see that, the kids get to know drugs very well. 1 in 5 drug abusers in some treatment programs, the United States received their first taste of these illegal substances from their parents, usually before the age of 18. The survey found that drug treatment candidates at 70 Phoenix House drug treatment programs in the United States are 19 times more likely to have been introduced to illicit drugs by a family member than a professional drug dealer, according to Penn, Schoen, and Berlin Associates, the national research firm in New York that conducted this particular study. Folks, 20% obtained drugs from parents, and of these, 6% even used heroin with their parents. I say with their parents. These findings should disturb everyone involved in preventing drug use among kids, says Dr. Michael Rosenthal, a psychiatrist and president of the Phoenix House. Rosenthal believes the findings of this survey reveal too many parents in America view teenage drug use as little more than a rite of passage. Not a representative population. The study does not apply to a general population of drug users. However, it's important to realize that these are kids who have already gotten a serious effect with drugs and have also had some trouble with the same drugs, says Elise Booth, spokesman for the National Center for Addiction and Substance Abuse at Columbus University, New York City, commenting on this study. I don't think 20% of parents across the country are smoking with their kids or doing drugs with their kids, she says. Yet added, a large majority of baby boomers did use illicit drugs and are more likely to have a benign attitude towards the kids using them. That's a shame when you really hear that, folks. The survey noted similar levels of parent-teen drug sharing among whites, blacks, and Hispanics, as well as among urban and suburban residents. In this survey, we met neighborhood pusher, and he is a lot like us, Phoenix House, Dr. Rosenthal stated. Stephen Higgins, a professor of psychiatry and psychology at the University of Vermont in Burlington, says addiction professionals have known for some time that most people are introduced to drug use by friends and relatives and not by a professional local drug pusher. But he says this may be the first formula study that attempts to quantify the phenomenon. According to the study, 36% of respondents are introduced to drugs by neighborhood friends, 29% by school friends, and 19% by relatives. Family members who introduce youngsters to drugs include siblings, parents, uncles, aunts, cousins, and spouses. Of those who use drugs with their parents, 76% used marijuana, 19% used crack, 16% used cocaine, and 6% used heroin. The study poses significant questions about drug prevention and education campaigns, which call parents, the anti-drug and you urge them to talk to their children about drugs and how terrible and dangerous they are. In many households where parents do not embrace anti-drug values, according to the statement issued by Phoenix House, the kids have a higher percentage of drug use. Other addiction experts also questioned the value of anti-drug tactics in light of the surveys. For children who are exposed to drugs at home, School of National Drug Prevention campaigns become totally worthless, says Dr. Peter Rogers, a pediatric addiction specialist at Children's Hospital in Columbus, Ohio, who also serves on the Substance Abuse Committee of the American Academy of Pediatrics. He called the survey's finding shocking, even after working in substance abuse for 15 years. The message that is very clear here is that parents can have an impact on their children, says Columbia's Booth. She believes parents are unaware of the extent of their influence, both positive and negative, on the children. Parents have to send very clear messages to their kids about not using drugs, and those parents who use illegal drugs, such as marijuana, are likely to conveying very mixed messages. Family systems are powerful forces in shaping the attitudes and behaviors of our children, agrees Scott F. Bassinger, chairman of the Substance Abuse Assistance Council at Baylor College of Medicine in Houston, Texas. This information suggests the problem is not out there, but in here, in our homes. He says the survey suggests more efforts and resources should focus on families and education rather than the support of law enforcement attempts to stop dealers. I hope the Office of National Drug and Control Policy considers this survey and its data and makes judgment calls accordingly. The survey, funded by Phoenix House, looked at random sample of 528 current residents at the Phoenix House treatment program in New York, California, Florida, and Texas. Residents responded to 80 questions about their drug history and their views on substance abuse and treatment and policy. Phoenix House is a private nonprofit substance abuse treatment, prevention, and education program serving 5,000 adult and adolescents in 8 different states. Folks, it's pretty simple. We are role models in our own home. We need to start educating our children. We need to show them that drugs not only is bad for their bodies, but it will kill them. Call me at 844-405-HELP, and together we can help each other take our lives back. Folks, be good to yourselves, and more importantly, be good to each other. A simple smile to a total stranger can change their life, and it could even maybe change your life. May God bless you all, and thank you for listening to the Take Your Life Back Today radio show. Today, Tuesday, October 30th, and may God bless each and every one of you. Take good care. Goodbye.
The show is over, but your life starts today. Taking back your life's the only way. Keep faith, stay positive, push through. Take back your life, it starts with you. Alcohol and drugs can't control your life. Let go of the negative and the strife. Ralf Friedrichs is the man guiding your way. The show is over, but your life starts today. Call Ralf Friedrichs at 1-844-405-HELP. That's 1-844-405-HELP. We hope you love the show today and tune in next time. Take back your life today show with Ralf Friedrichs. Yeah.
May God bless you all and take good care of yourselves. See you tomorrow.